Hello, everybody, and welcome back to another episode of VIPs in Action, brought to you by Rose Breastfeeding Incorporated, located here in the Atlanta metro area, and JMM Health Solutions. I'm Dr. Joanne Michelle Martin, owner of JMM Health Solutions and a pelvic floor therapist and birth doula in the Atlanta metro area. Today, I am blessed with not one interviewee, but I've got 5 of them on the line. I'm feeling all types and sorts of special now. Because I've got this amazing group of women who are doing such great work in their region and serving their community. So I'm really happy to introduce in today's episode of VIPs in Action, the Southeast Michigan IBCLCs of Color, otherwise known as SEMI. They are actively involved in collaborative efforts to support breastfeeding with other organizations of color in the Southeast Michigan region, such as Birth Detroit and Metro Detroit Midwives of Color. They also use their position and platforms to teach equitable lactation support practices to mainstream dominant culture healthcare providers who serve families in their community, as well as providing breastfeeding education and support to families of color. Their mission is to meet the unique needs for mentorship, fellowship, and professional growth for IBCLCs of color in the Southeast Michigan region in order to supply their community with equitable access to culturally appropriate lactation support and advocacy. And they don't disappoint. We are now about to speak to a collective of amazing, talented, educated women. And I'm so honored to be here to join you guys. So thank you so much for joining me today. I'm going to let you guys, unmute yourselves and just tell us a little bit about each of you, and then tell us a little bit more about SEMI. Am I saying it right? Is it SEMI or semi? SEMI. Okay. All right. Well, I'll start with you first, Dr. Johnson. Tell us a little bit about you and your involvement with the Southeast Michigan IBCLCs of Color.
So I am Sakita Lewis Johnson. I am a family nurse practitioner, board certified, as well as a IBCLC and a birth doula. I am one of the co-founders of Southeast Michigan IBCLCs of Color, and I just love us. We work collectively, we work together, and we are amazing as a team.
I love that.
Thank you.
All right, Renee, how about you?
My name is Renee Pearson. I'm a board certified lactation consultant, and I work in an urban hospital setting. The majority of my time is spent there, but I am very excited to be a member of SEMI. I've known these ladies for a long time, working in the community, collaborating from WIC to state legislature to advocacy to marching at the Capitol on enough sign to protect breast milk. So I'm just really excited to be a part of SEMI and being able to reconnect to my community and serving those vulnerable families who were unable to seek lactation care if it was not for SEMI doing home visits and telehealth and support groups and breastfeeding classes. So I'm just honored to be a part of the group.
That's amazing. That's amazing. Tamika.
Hello, I am Tamika Jackson Dyer. I am also an IBCLC and a co-founder of SEMI. Like all the rest of us, I wear a lot of hats. I am the newly appointed manager of community collaboration with Cofective. I'm also a private practice. I own my own private practice. Most of us do. Crazy Milk Lady Lactation Support Services. And my passion is being able to, my passion is fighting for the underdog. So as part of SEMI, I am able to make sure that the families that usually don't get their voices heard are able to be heard at all the tables and in all the spaces where they need to be. Like the rest of us, I don't back down easily. I'm very passionate about what we do. And so making sure that the women and children and families in our community are able to get the lactation care and support and education that is normally out of reach due to cost or other barriers is very important to me.
Wow. Crazy milk lady. I like that. Miss Jennifer, how about you?
I'm just grateful and blessed to be here in unity with our sisterhood. And I serve in, like Tamika said, multiple capacities, but so grateful to serve. I own also a private practice, Feed the Babes, where I am a board certified lactation consultant, a birth doula. I've also done some postpartum doula work over the years. And within my private practice, I'm a dual citizen, Canadian and American dual citizen. So during COVID, I've not been practicing in Canada, but I have an outpatient breastfeeding clinic in Windsor, Canada as well. And then I also serve as community building project manager with the Michigan Breastfeeding Network, where it is just such a blessing to be able to be in that space, serving alongside and amplifying so many amazing Black-led, Indigenous-led organizations around our state, and passionate about getting funding into the Black community, the Indigenous communities, because we know the best as to how service should go in communities. And so the work needs to reflect that of the community, and those that are experienced, the experts, skilled, are the ones that should be equitably compensated to do the work and supported. So I'm just so grateful to work in these spaces alongside so many amazing women. This is where we have our cup filled. Because this work is hard, it's tumultuous, but when we come together, it's like, okay, I can go on another day.
Yeah, support is very important, and to have those people, like you said, that fill your cup, and those people that, kind of, they're with you, no matter what kind of day it may be, no matter how tough it is, no matter if it's, and I know being at the Capitol, getting legislation passed, and I'll ask you some questions about that too. It can be hard, right? Like you really have to be about the work. So that is amazing. And last but not least, Chante, you are ready.
So ready. I'm the PPE example right now. I am Chante Smith. I'm a board certified lactation consultant, a birth doula, childbirth educator. I too have a private practice called YOLO. This is an awesome group of women. I'm the tinker. That's what they usually call me. I'm a tinker of the group. And I usually want to make everything pretty. I'm like, oh, let's design it like this. So that's usually my little role that I like to play. And I'm from Detroit, even though I live in Genesee County. So it's great for me to have had this sisterhood, being that I was here and it wasn't people like me out here. So it was great to have this sisterhood.
Wow. So tell me a little bit more, and any of you guys can answer this. Tell me a little bit more about the general makeup of that Southeast Detroit region. Are you finding that there is a lot of lack in terms of education, resources, whether community-based or otherwise, for, families, mothers, families, breastfeeding individual or chest feeding individuals rather within that area?
But I will answer that, and I'll say that there's a lack of culturally appropriate care. And I mean, getting down to the nitty-gritty of access and getting down to certain biases and stereotypes that actually is a turnoff when you're providing care to folks, and that's how you behave in your ways of being. So that's pretty much what I'll say about the lack, is really about lack of representation.
Got it. And with regards to the last year, I mean, because we've essentially been dealing with COVID for at least about a year now. I know here in Georgia, we shut down in March, and it's about to be March again next week. And so it's whereas we're all just like, oh, maybe it'll be 2 weeks. And then it was like, oh, we're in this for the long haul, right? What issues did you see come about? What struggles did you guys have? You guys all do in-person sessions, you guys do home visits, right? And sometimes, and we have to meet our clients where they're at, right? I don't want a mom who's got, 4 little ones coming out of the house if they don't need to. So yes, I'm going to go to them, right? I don't want to have someone, like driving for 2 hours just because there's no one near them when I can jump on a video chat with them. So what difficulties did you guys experience in the last year with regards to continuing to serve your population the way that you normally would?
So as the paradigm shifted, our need for access to service our moms had to shift. And so that's where the telehealth came in, and we were able to create a referral base for families who needed that face-to-face lactation care in their home regarding, and then we develop PPE guidelines and infection control guidelines so that we can service these moms in a very safe and comfortable environment.
Mm-hmm. I like that.
So the first thing that happened was that services that would normally be available to our families were not. So WIC in the state of Michigan has to have an IBCLC on staff in every agency. And just about every clinic has a breastfeeding peer counselor, but they shut their doors in March. And some agencies weren't even doing telehealth or video or phone calls or anything. It was just like, we can get you signed up for WIC and we can give you benefits over the phone, but that's about it. There were no pumps. There was none of that. And so because several of us have WIC backgrounds, we're like, okay, that's not going to work. Like, people need help right now. And so like what Renee was saying, that we've known each other for a long time. We've worked with each other outside. Well, we're friends outside of work. And so we were chatting and it was like, okay, so what we're going to do? And we came up with, well, we can go and help people. We can start classes. So we started all of these things because of the need. And then, people fell in line. So it was like, oh, well, you all are going to see families. Well, what do you need? You need supplies. We had a big fundraiser, thanks to the network, MIBFN. And we got funds so that we could be equitably compensated for our work, because that's important. We love what we do, but we still got to eat. And then, supplies. So like the state WIC coordinator was like, oh, the clinics are closed, the pumps are sitting there. Let me get it to y'all because you're going.
Uh-oh, I think I might have lost her. Okay.
So we because that's how we operate. Oh.
Yeah, I think I lost you there for a little bit, but that's okay. I mean, yeah, I it's interesting how a lot of big organizations that were, typically supporting families all of a sudden closed without any alternatives. And it was really, what was very evident was the smaller business, the birth workers were coming in droves. They were connecting, they were collaborating, but they recognized that stuff still needed to get done. Like, just because COVID's here and stuff is shutting down doesn't mean that babies aren't going to be born. Doesn't mean that, moms aren't going to get pregnant, and doesn't mean that babies won't eat, right? And we still have to figure out ways to take care of these families and make sure that their needs are being met. So I commend you guys for that quick transition, and being able to still offer services and help and education to moms, because, COVID in and of itself was already stressful. So we got that added burden.
Right.
And now it's like, wait, you want me to breastfeed this child? But I'm stressed out.
Yes. And And to Tamika's point, I just want to say real quickly, we did that with zero money in our pocket. And so, yes, Tamika's like, yeah, we need to eat. But when the pandemic hit, we immediately started talking and was like, yep, we need a class, we need this. And so that's the importance of knowing what the community needs and knowing your community. We already knew. And one of my colleagues threw me under the bus the other day. They said, oh, Sakita whipped up a PowerPoint in like 24 hours. I don't think that's true. It might have been 2 days, but we did this with no money. We don't have a budget. We didn't. And so it was like mobilizing. And thankfully, the state of Michigan donated tons of equipment to us to be able to still service the families that they couldn't serve. So that was huge. And so I just wanted to plug that, because I don't want to make it seem like, you know, the state of Michigan just left the people high and dry. No, immediately Tamika leveraged her relationships with people she knew at the state level through WIC. And I mean, all of us got loaner pumps that we could take to NICU moms who were not able to access those pumps. We got actual personal pumps that we were able to take because the DME companies were also having problems, meaning, you know, and so leveraging relationships and knowing the community and being able to act quickly, even though we didn't have a budget, people saw those actions, and that then made folks want to help us even more. And so we are appreciative that we were able to be in a position to act quickly, but also to receive the support as well, in addition to role support.
Imperfect action beats perfect inaction every single time. Every single time. As long as you see the need and you make something happen, there'll be a lot of other people over there to help. And that's great that you guys were able to do that. I'm, like I said, I applaud you guys for that amazing work. What are you finding in terms of, so COVID happened, we transitioned. Were you guys surprised by the amount of women and families that you were seeing on the workshops or the classes and the Zooms? Were you surprised? Were you finding that you were having access now to more women than you had before?
I wouldn't say surprised. I think we were prepared for the shift that was going to take place. Because again, Southeast Michigan, hardest hit, one of the hardest hit areas during COVID, Detroit. So while all of this is happening, we're experiencing families in the community that are having losses, like in their immediate families, while also pregnant and preparing to give birth, and experiencing hospital systems changing their hospital policies and separating moms and babies. And so these families, mom, dad, family, they're experiencing, oh God, what am I going to do? Out of fear, right? And so even when it comes to classes and support groups and everything, there was a gross disparity in services, even beyond like lactation support postpartum. There was education that was also impacted because hospitals were shifting and closing because of what's happening in the hospital systems at the top of COVID. That means breastfeeding classes are canceled. That means baby showers are canceled. That means all of the things that where we go for our village, they're closing and shifting. And so I think we were prepared in the sense of these are folks we actually are in relationship with, because again, what's unique about our unit, our collective, is that we work in almost every single space. We work in the hospital, we work in the community, we work in advocacy, we work in project management, we work in consultancy, we work literally all across all systems. And because of that, we were prepared to know, okay, this is what we got to do. Got to get this class. I was the one that threw Sakita under the bus. Got to get this class together. Okay, in 2 days, not 24 hours. It felt like 24 hours because it's quick. This is stuff.
It is quick. You got to be ready.
But, or 2 weeks or a month, a whole curriculum, and then support groups. And Tamika being like, okay, we have families, us ourselves are experiencing losses. I can recall losing count with 17 family members that died of COVID in like 3 months. We don't remember the number anymore. We've lost count. I say this in like the spirit of like sharing, but it's been devastating for our family. right? Families are experiencing this great loss too. And so in the moments of when we're experiencing these things, Tamika's like, look, we need like mental health support for our moms, for our families. We have the support group space. We need to make sure that every single support group, there's a mental health counselor accessible for the families. And it's also helped us as providers in the space too, right? This is hard for families, for community, and it's hard for us as providers. So I think we were prepared with like how to quickly jump into action and mobilize because we're connected across the community, across the systems, across the state. Like SEMI isn't exclusive to SEMI. We also have far-reaching relationships. And it's all based upon sisterhood, which is so unique. It's not, I'm being sarcastic. It's not unique. It's a culture, right? But it's unique when you actually lean into what you know.
When you lean into it though.
Yes.
Yeah.
I want to say it, and I just want to just pay homage to reaching our sisters everywhere, because as Jennifer just said, the relationships that we have, that was critical to also be able to provide telehealth. There were some missed opportunities that were happening for one-on-one, even just doing antenatal, which means before you deliver, lactation consultation, preparing, because sometimes classes is so impersonal. There's lots of folks. Sometimes you have to connect one-on-one to discuss certain aspects of your own physical body. So in saying that, having the relationship with Rose predates us actually being grantees. And I just want to plug that they truly do reach sisters everywhere. And I ain't crying today, y'all, but I'm just saying, like, this has been amazing, amazing.
That is so wonderful, and that's such a wonderful tribute to them. And it is true because the general consensus is felt across the board on everybody holds them in such high regard. They are truly amazing. They are about the work. They are about community. They are about sisterhood. They are about family. And, they talk the talk and walk the walk. So, and that's, there's a lot of people that talk, but not all of them walk the walk. Right. So, I mean, that was a beautiful thing with regards to infrastructure, because that was one of the common issues that I heard from many people, in terms of inability to really, even though they did pivot, inability to reach some communities because infrastructure was not the greatest. Network reception, internet, even people having access to internet and so on, so that they could conduct the telehealth sessions and stuff like that. Did you ladies run into any of those issues? And if so, how were you able to address them?
So, the beauty of SEMI is that we are small and nimble and able to move as needed. We're not like a government organization where we have to go through, 5 different chains of people to get an answer for something. And we decided early on that there are some situations where you just got to be there. Like, telehealth is great, virtual is great, but sometimes you just have to be there. And so that was part of the reason why we had the fundraiser, was to make sure that we had equipment, which was difficult because, in the beginning, you couldn't get equipment. Even if you had money, you couldn't get equipment. So, we had some of the members of MDMOC, Metro Detroit Midwives of Color, actually donated some of their stock of N95 masks to us so that we could go into the homes and be safe. People sending us sanitizer, and families in the community making masks for us to have for ourselves and to hand out to our families. So that was one of the ways that we were able to make sure that everybody who needed services got services, because there were so many instances of families falling through the cracks because of, hospitals discharging people within 24 hours of delivery, not being able to get that follow-up appointment with the pediatrician, 3 to 5 days after baby comes. I had one client who he was 2 weeks old, and her appointment was like maybe 3 weeks out.
Wow.
And this baby he wasn't gonna make it 3 weeks. So it was really, really important that we be able to reach the people wherever they were, however we needed to do it. And so that was, all of our community and our friends and our networking and everything kind of came together to make sure that we could reach everybody that needed to be reached, however that needed to happen.
And to that point also, keep in mind, as providers, we're also people and humans that are experiencing this pandemic too. And so one beautiful thing of telehealth options, and once things shifted with like actually having access to all of the supplies needed and platforms to provide telehealth services, was we also had experiences of exposure. We also had scares of, oh God, I need to go get tested. Do I have COVID? Does my family member have COVID? And we were still able to provide services to families while away and not able to do in-person visits. And the allostatic load of, I want to do this work, but I just am not comfortable with going out and doing this work. And there may have been a week like that. There may have been a month like that, but families were still able to be served, even if we had our own individual concerns with going out and into the community. Because again, this is heavy, this is complex, and it's also a heavy burden to carry of, I want to do this work, but it's difficult. I can say almost all of us went through like highs and lows, ebbs and flows. Like, we are committed and passionate to this work, and this is hard. Right? And so knowing that, like, there's options in making sure that families get services. Of course, there was the, hey, can you go? Hey, can you go? Because we work in synchrony. Like, again, we're very different. No, we're not. It's just we actually get it. In that, like, yes, we all have our own private practices. Yes, we are semi, but we have our own private practices, and we actually love each other. And so if we get a referral, I'm like, hey, I can't go see this client. Tamika, can you see this client? Renee, Sakita, whoever, Chante, can you see this client? Because I just can't. Like, that's beautiful to me. You don't see that everywhere, even though this is the way that it's always been, right?
Scarcity mindset is something that is so prevalent in our culture. We think that because other people are there, that it's going to take from us instead of add to us. And I think that one of the things that people fail to realize, there is plenty of birthing mamas, there are plenty of breastfeeding families, chest feeding families, there are plenty of babies that need help. There is no shortage. There's actually not enough of us to do the work, right? And so the ones of us doing the work, we got a lot of work to do. But, and I think if people adopted that mindset of, hey, there's enough to go around. Yes, I can help you. I can be here for you. What do you need? Oh my goodness. Think about how many more families could be supported in that way. It would be a beautiful thing. Oh my goodness. I mean, you guys have brought up so many points. The mental health aspect of it all. The fact that as moms yourselves, I'm sure many of you guys are moms and you've got your own kids and now you're homeschooling while trying to work, while trying to provide care. And you're like, yes, I want to go out to see this patient, but I got these kids at home. My kids are 7 and 5. So that was my life. And so I'm like, yeah, I can't go see people. I can provide my services virtually. And it was a real thing. And, so those are, it's been a year, definitely been a year. So I want to turn a little bit to talking about some of the services that you guys provide in the hospital. Chante, I see you're in the hospital. Do you guys as a collective go into the hospitals and work with the moms? Are there any hospitals, for example, that you guys are aware of that may not have lactation services, or may not have enough representation in terms of a lactation professional, so that at least moms can get some sort of knowledge, education, things of that sort?
I would say we're not in the hospital as semi, quote unquote, but let's see, 1, 2, 3, 3 of us work in the hospitals. And then I would say referrals, like the hospital systems refer to us because some of them aren't doing classes, aren't doing childbirth education, not doing outpatient clinics right now either. So referring to our services has definitely helped them to continue to help families also.
Yeah, that's awesome.
I would just add that one of our services, which is our Mama's Mobile Milk, which is a service that transports milk to mothers and infants or parents and infants that are separated from either or by the NICU, custodial issues, CPS issues. And so that's one of the ways that the hospitals have been referring to us for those needs as well, connecting us with moms in the community who may have transportation issues and can't get their milk back and forth to the NICU, which is still so important. And so that's it, especially in the Detroit area and also in Genesee County. We've been really trying to do our outreach to make sure that people know that that's a service, that's what we do, and it is community, it is by volunteers. So no one is paid. We have a whole nother service model. So just thinking about the ways in which hospitals, how we interface with hospitals and the services that we provide and are available for from hospitals.
Yeah, it's sometimes it's the little things, because I don't know that many people consider those things. When a mom has to leave a child and the child has to be in the NICU, and many women have given up on breastfeeding because of situations like that. I've known many that I've referred to, IBCLCs, and, it's just frustrating that they're at home, they're having issues with pumping, their baby is in the NICU, they've got that stress, maybe then they've got to go back to work and all these different things. And something as simple as just being able to know, when I produce my milk, my baby can have that, that's comforting. That's, they're still able to nourish their baby, even if they can't be there all the time. That's something that's comforting. And I think that, we oftentimes don't think of the little things, but something like that is invaluable, I think, to the community. So kudos to you for that. Oh, go ahead.
I was just going to say, Tamika mentioned how the community showed up for us with masks. One of the things that people didn't think about also were, how were parents going to get masks? Like the average person just can't go out and buy. So one of the, we put a call out for a company who said, I am making them for free. And initially when she said that she's making it, I'm like, okay, that's not bad. I sent her a messenger like, yeah, I need a lot. And she's like, well, how many do you need? I said, well, 30 to start. And she's like, okay, pick them up on Sunday. And I was like, for free? I mean, we were just like, those at the very beginning, we started advocating, we need masks for moms. Like, I know they're telling y'all don't wear masks, but we're science majors. We need masks for moms. They're only saying it because it's a shortage supply. No. And so I just wanted to plug Michigan and Chickadee also for providing that and still providing services like that for the community.
Wow.
You also mentioned earlier about whether lactation consultants were still available or accessible during breastfeeding needs, during birthing and breastfeeding in the hospital. Something that occurred during maybe as early as April, May, we started seeing that as hospital elective surgeries and things like that were all being canceled because of COVID, there was also a loss of revenue for many health systems. And because of that, many health systems were laying off staff. Here in Detroit, we experienced that massively. Like every time you looked at the newspaper, another 1,000, another 10,000, another 7,000 staff being laid off of whole entire health systems. And included within those staff were lactation consultants. And so based upon that, we were experiencing in the community families saying, I never saw a lactation consultant in the hospital, period. It's not that that's new. We also have experience before COVID, but that goes to speak that it was really bad because there was just nothing. And so specifically within Detroit, as well as statewide, we still are hearing stories where like they're still scaling back or they're still not rehiring to make sure that there's more than one lactation consultant. I know in Detroit, there's an entire hospital where there's one lactation consultant.
There's several of those here.
Right. And so this is, I mean, when we're talking about families and the critical time of birthing, especially in a pandemic, breast milk, human milk is preventable health. This is something that is needed, especially in an emergency. And so it was, it's devastating to us that hospitals do not see the value, health systems do not see the value of our profession.
In addition to what Jennifer just said about the layoffs, I'm going to get on my soapbox for a quick second. The fact that those who were being laid off were mostly lactation consultants who were not RNs. Because if they were RNs, they were being pulled from lactation to go work on COVID floors or to scrub in on C-sections or to do other things. So lactation was not considered a priority, and they were putting them somewhere else. And then if you were just a lactation consultant and not also a registered nurse, then they just laid you off. And that's because, like Jennifer said, they don't see the value because many healthcare providers still look at breastfeeding as a lifestyle choice rather than a public health issue. And we know better. We know, especially in the middle of a pandemic or any kind of emergency, infant and young child feeding should be focused on the access to human milk, because human milk is literally a lifesaver in situations like this. When we saw where the stores were completely, the shelves were empty. Okay, you got WIC, that's great, but you can't cash in your voucher if all the formula is gone. Things of that nature. So being able to supply your infant with your milk is something that could literally save their life in the middle of a pandemic or any kind of emergency. And the hospital systems just were not, they weren't viewing it through that lens.
It's tough. What have you guys done in terms of like when you have issues like these, and I'm sure like many other states, you guys have probably got quite a few issues that you have to take to the Capitol or you've got to take to the next level. So what are some of the issues that you guys have been fighting for there in Michigan, in that Detroit area?
Will someone talk about the advocacy issue that happened? Y'all know what I'm talking about. That y'all just went in rogue and was like, oh, y'all changing this policy at a hospital. Will somebody just address that?
Ooh,
Because we are linked to the community, boots on the ground. Someone reached out. It was actually a doula. Reached out to us because one of her clients had been separated from her infant in the hospital because that was their policy during COVID. If they suspected or thought that you might, it really was just, anyway.